what are the factors which will give you idea about whether you want to operate, you don't want to operate, and then obviously your approaches, when to operate, and then what kind of reductions, what kind of fixations you can do. So this is all decision making. There are going to be few repetitions because we did not match our lectures. So I think repetition is going to be good for you. So what decisions, operate or not? There are a lot of factors. It is not only the radiology, you look at the x-ray, I will show you example, and then because these patients, they are sometimes part of polytrauma, there are a lot of associated injuries, they are sometimes life threatening injuries. So those injuries, they sometimes change your decision making, right? So patient factors, they are very important factors. Then fracture factors, most of the fracture factors we have already taken into account. Then very important is hospital setup. I want to tell you one thing, this is not a surgery of a very small setup. You need sometimes, because maybe you will need the help once in a year, but if you are working in a very small setup and if that help does not arrive in time, then you will lose the patient, right? And then the training of surgeon. First, your understanding is difficult, then your approaches are difficult, then your reductions are difficult, then your fixations are difficult. So a lot of training is required. So surgeon training is also very important. So what approach then you want to do, it's a single or a combined approach, and extensile, I don't think anyone is doing extensile approaches, because most of the fractures, you are able to approach with a single or maybe two approaches, straightforward approaches. So patient factors, if you look at, we got this scan from a hospital, and obviously both of us thought it looks such a good fracture. We'll apply a plate from here to, and then we'll reduce this T-shaped pattern, and we'll fix up everything. We took the patient, and this was the scan, and when the patient landed up, this is from the back side. From this wound, we could see the prostrate, we could see the dislocated femoral head in the pelvis, and the patient had got a lumbosacral spine injury, he had a colostomy done, he had a bladder injury for which they had suprapubic cystostomy was done. So he was in such a bad shape. We just looked at the